So Dr. Andrew Taylor Still, born in 1828, had a family practice, a thriving family practice, really. Then he lost 3 of his children to spinal meningitis, and later his wife in childbirth. So all these tragedies combined made him look at the human body differently, and he dedicated his life to finding different ways of curing disease. During his years of clinical research and observations, he found that the body really needs to be looked at as one unit, that structure and function are interrelated, and that there is an underlying intelligence in the body, meaning that we inherently have something that wants to keep us at equilibrium. And by looking at the structure of the body and correcting misalignments of subluxations, or whatever you want to call them, you would free up nerve force, you would free up the nerve space, and in doing so you would also free up blood flow and lymph flow. And with all of his findings, he decided to dedicate that work to open up a school called the First American School of Osteopathy. Dr. William Garner Sutherland came along and attended his school, graduated in 1900, and his fascination became with the cranial bones. So much so that he decided to experiment on his own head. Bought a helmet that you could adjust and put pressure on different areas of the skull, and years of research on that on himself, he found that there really is some mobility in the cranial membranes and bones, and that there was a connection between the cranium and the sacrum by way of this membrane. And he also found that there is some fluid movement within the membranes, and which is called the cerebrospinal fluid. He found that there was this movement in there, and it had some intelligence, and he called it the breath of life. So out of this work of these founding forefathers have been many diversified and different approaches to this work. And in the 70s, Dr. Upledger first coined the term CranioSacral therapy. But all of these different approaches and different ways of doing it in a clinical setting, the basic idea still goes back to listening to the body, applying gentle, subtle pressure, and in effect, you have great, profound change.